I'd like to pose a question to you about your pupillary exam because this is a very important part of our trauma assessment. We get NPIs on all our trauma admissions. This is actually a risk-adjusted variable in our TQIP measure, Trauma Quality Improvement Program, that all trauma centers are held to. So getting a pupillary exam, especially on a patient with a traumatic brain injury, is important. This actually, though, came up today. So say I have a patient who comes in and their GCS is 3, okay? What are we gonna do? Well, we're gonna start with ATLS, and so for airway, we're going to intubate this patient, okay? So they're gonna get intubated with an endotracheal tube. What medications are gonna be used to intubate the patient during their RSI? So rapid sequence intubation or rapid sequence induction intubation. Well, they're gonna get a sedative and a paralytic. So that's where today's discussion went. So say they get succinylcholine or say like rocuronium. My question to you is, what happens to their pupillary exam? Because we got into this discussion today. Does the pupillary exam change or become affected by this paralytic, whether it's depolarizing or non-depolarizing? Because there's a difference between the two. Well, the answer is it does not affect your pupillary exam. So this is extremely important in this patient population. And why is that? Your pupillary response is an autonomic response from your cranial nerves, whereas these are acting on your skeletal muscles. And so keep in mind, the depolarizing agent is when you get those fasciculations when you give the medication. So you learn something new every single day.